I'm opening my slides.
Sir, madam has also joined, Dr. Sanika. I think I can see her over here. Yes.
So, Varindam, can you able to see my screen?
Yes, sir, visible, visible. And I think, sir, our faculty has also joined. I just saw her in the meeting.
Okay.
Dr. Sanika is here.
So, hi guys, this is Dr. Akram here from Sydney, Australia. So, today we are going to discuss the opportunities for you as a dentist, how you can migrate to Australia. So, if you have any questions, let us know, at the end of the webinar. So, I will talk to you one-on-one. Even our faculty is also here, one of the faculty. So, you can ask if you have any questions related to the exam. So, you can ask basically anything regarding the Australia exam, job, visa, anything, any questions related to it, you can discuss with me. Okay. So Academically is a Australian tech company, and we provide assistance for all healthcare professionals like medical doctors, dentists, pharmacists, nurses, lab technicians, optometrists, veterinary doctors, and so on. Okay. So any healthcare professional want to practice in another country, as you know, they need to write some exam or documentation process. Then easily you can migrate. So Academically provide A to Z assistance to migrate to Australia, and we are a Australian company based in Sydney. So this is a very short introduction about me. My name is Dr. Akram, and I'm Indian pharmacist, like bachelor's, master's from India, and PhD from University of Sydney, Australia. I have around 10 years of teaching experience for pharmacology, clinical pharmacology in India, Malaysia, in Australia. So these are some of the faculties for this course. So, you can see here the scope of dentistry in Australia. You can understand from this one slide. So this is a patient basically, So he went to a dental clinic and they asked him they will charge 100,000 Australian dollars, like 5 lakh Indian rupees. They was asking for to him, In Australia, it is basically very very expensive. This I can say, it's like unaffordable. This much cost for the dentistry. So what he did some research, and then he went to India and he stayed there 2 weeks, in 4-star hotel. Then he roaming around Hyderabad here and there. So around 15,000 he only spent, and 85,000 basically he saved this dollars. That's why this is the news in Australia. So the treatment of dental treatment in Australia is very very costly because not too many clinics or hospitals are available. So a lot of dentists they need in Australia. So we can say like demand and supply is the main issue in Australia for dentistry. That's why treatment of dentistry is very very high. So you can see the earnings of a dentist can earn a lot in Australia if you migrate as a dentist to Australia. This is basically a SBS Hindi, very famous. This SBS is a government supported. This is a news agency in Australia. So they publish in different languages like Hindi or different languages. Just so many languages publish their content. So in Australia, basically the opportunities for dentists or overall. So Australia provide 190,000 permanent visa. Okay, so this visa for any healthcare professional basically. Okay, so dentist also one of them in that. If you completed this process, you are eligible to apply your PR visa or permanent visa. You can live and work in Australia permanently. Even you can change your citizenship after 3 years if you got PR visa after that. Okay, so if you see here, this is the one of the very famous website in Australia called seek.com.au. Okay. So any job if someone is looking in Australia, so you have to go seek.com.au. You will find hundreds of jobs. So recently what I did, I just typed this dentistry or dentist. So I found around 2,242 right now. The advertisement is ongoing for this. And if you see here, in the next 5 years, this is a projection. This is going to be a 28%, around 28% growth for dentists in Australia. They need more dentists in next 5 years. In average salary, around 180K Australian dollar per year, and it's going to be around 90 lakh to 1 CR per year in Indian rupees. Job satisfaction also is very high for the dentist. This is what I think. So you can get basically permanent visa, very high salaries, and a lot of jobs are available in Australia once you completed the whole process. There are several other advantages to migrate to Australia. For example, the kids' education. So if you are married and if you have kids, so education in kids in Australia is free. If you are on, and healthcare access also is free. So if anyone migrated to Australia, there is a universal health coverage, and you no need to worry if anything happened to you or your family. Is everything is free in Australia. In case of US, you need to buy insurance there. Then only they will cover on this healthcare. So it's like healthcare is a commodity in US, but in Australia is a universal health coverage. So you no need to worry. Anything happened to you or your family, you're free, and education is also free. And professional development. So if you are working in any clinic or hospital, so at least yearly 1 to 2 times they will allow to all the staff, they can attend workshop, or if they want to attend any course or any training. So whatever the cost involved, the hospital in generally they will pay. And work-life balance is a very good example in Australia. So obviously here you need to work basically 38 to 40 hours weekly, means maximum 8 hours per day you need to work for 5 days. In India, you might working maybe 12 hours, 11 hours, 10 hours is very, very common there as a dentist. And here opportunities, as I mentioned, a lot of opportunities available, and fast track PR visa. Any healthcare degree holder, if they complete this process, they will get fast track. And quality of life is very high in Australia compared to India. And high potential, as I mentioned earlier, 1 CR up to you can earn easily in Australia as a dentist in Australia. So these are the some steps you need to complete in order to migrate to Australia. First step is called document verification, or data flow we call in Gulf countries. Here we can say skill assessment. They will, in general, they will just check your degree and your registration as a dentist in your state dentistry council. And after this, we will help you to complete this process. So no need to worry about this step one process. This is done by ADC, Australian Dental Council. Okay, we will help you to complete this process. Then you need to write this ADC written examination. Okay, so this is around. We will provide you the coaching for 4 months, around 3.5 in 4 months, including the revision. Okay, so in general, we will take a lecture 8 to 10 hours weekly, live sessions, and we will provide you the study material, relevant materials, and plus mock test for that particular topic. And once you pass this, then also you need to pass English proficiency tests like IELTS, OET, or PT, any test you can give. This is the APRA requirement. Basically, you need to go for 7 individual band IELTS, or OET B, or PT 65. So overall, basically, they need individual band 7. This is the APRA requirement for all healthcare professionals like medical doctor, dentist, pharmacist, nurses, physiotherapists. So this English requirements is the same for everyone. Okay, and once you pass this, and then you also need to pass this ADC part 2. And once you completed this, there is a more, if you are in Australia, there's a very good chance for you to get job as an assistant dentist or dental hygienist. Lot of jobs are available. Okay, you can work. And so this part you can write in your home country. Home country means in India, you can write, but some country do not have the center, then you have to go nearby country to write this exam. Okay. And this part two exam, basically, you need to come to Australia to complete this exam part two. Then you will get full registration. Then you can practice in Australia. This is English proficiency test has mentioned that seven band individual we need for IELTS or 65 in PTE, 65 individual or OAT-B. So basically, highly recommended go for OET or PT. These are the easier exams as compared to IELTS or TOEFL. TOEFL is not accepted in Australia. So any of these three tests, you have to choose anyone. Then some of the documents required like degree, transcript, if you have any work experience, and valid passport, government ID proof, or passport photograph, dental registration, a good standing certificate is very important and need from the Australian, your dental council where you are registered. And these are the exam, basically 20 questions last around 8 hours exam paper. And minimum a grade required to pass A or B. And no negative marking. And we will provide around 4 month coaching for this exam, ADC part one. And pass is part two, then you are eligible to apply permanent visa like 190 PR visa. Okay. Or this also you are eligible to apply 491 visa, regional sponsored visa. And these are the two work visa also you are eligible to apply. The other fees, our team will give you the more information regarding this. And for Indian citizens, we are providing the loan facility for 12 months, 3 months, 6 months, 9 months, 12 months, without paying any interest. So zero interest rate. You can join us to the EduOnes. This is our financial partner, EduOnes. Here are some of the reviews from our students for academically. So yeah, that's all. So now we can end talk one-on-one with you. And I also highly recommend it for you guys if you want more information. So I always make content for the uh, dentist. So please subscribe. This is a very specific channels we have. So MedPrep abroad by academically. Please subscribe this channel. You will get a lot of information in the dentistry in Australia. Many opportunity for you and like it. Okay. Now we can talk one-on-one. Whatever you have questions, you can ask. Yes, please unmute and you can ask.
Sir, is the Indian post-graduation degree valid over there?
Yes. So any degree basically in India approved by UGC, right? Any university, and that college approved by that Australian Indian Dental Council. So it is approved in Australia. No worries.
So the exam is different for a BDS candidate and MDS candidate, sir? Like
Same exam. Same exam.
same exam. Okay. So will I be considered as an orthodontist there also?
No, you have to do separate training for that.
So what I did in my masters in India is of no use after going there, sir.
In India, you are earning maybe 50,000 rupees after your master degree. You are going
Yeah,
to earn here maybe 5 lakh or 10 lakh, right? So you
yeah,
have
yeah.
to see, it is not just the name. In India, they can give you, yeah, you are a director, but they are paying for 20,000 rupees. So what's the use of the title for director? Is that right?
Yes, yes.
So you have to think
Yeah.
it's not just the money, quality of life and your family member, your wife, kids. So think about that, it's not just the
Yeah,
money.
yeah.
But if it is Australia, US, Canada, UK, anywhere, the high income countries have the similar. Uh, Hi, Sanika, are you there? Yes.
Yes, yes, Dr. Akram, I'm here.
Okay, okay. Yeah, Dr. Sanika also here. She's our lecturer. If you have any specific questions also, so she can answer. Yes, Dr. Lata, can you please ask? Can you please unmute yourself? Dr. Ansar Ghafoor,
अस्सलाम वालेकुम रहमतुल्लाहि व बरकातुहू।
welcome, salam. How are you, doctor?
सर आप मुझे सर ये बता दें कि इसका एडीसी का जो कोर्स है, तो हम इसको कोर्स को कहाँ से हम स्टडी करेंगे, कहाँ से स्टार्ट करें, कहाँ से ख़त्म करें, ये
ये
नहीं
तो
समझ आ रहा।
that's why you have to join us. वही तो हम बताएंगे आपने कहाँ तक स्टार्ट करना है, कहाँ तक खत्म करना है. That's why we are providing the 4 month coaching for this to complete this.
सर इसकी कोचिंग के फिर क्या चार्जेस हैं, तो फिर कब से स्टार्ट है?
वो you just leave us on your number or email in the chat box, so our team will connect to you digitally. Okay? Then he will give you all the information regarding the fees, installment, the scholarship, all those things.
सर मैंने क्योंकि असल में पाकिस्तान से मैंने ग्रेजुएशन की हुई, तो बीटेस तो इसकी वो तो डिग्री तो इक्विवेलेंट होगी ना?
ये इक्विवेलेंट है. आपने बेसिकली एनी 4 year डिग्री जो है डेंटिस्ट्री में किसी भी कंट्री से किया है, इट इज वैलिड इन ऑस्ट्रेलिया.
सर अभी हाउस जॉब तो अभी कंटिन्यूअस है, मार्च के अंदर अभी हाउस जॉब खत्म होगा, तो फिर इसके बाद ही अप्लाई करना होगा ना?
हाँ, तो आप कोचिंग तो कर सकते हो ना अभी से, आपको 2 बार पढ़ने को मिल जाएगा.
हाँ ये बात है, बिल्कुल बिल्कुल।
बेसिकली एग्जाम ये 2 बार ही होता है एक साल में, मार्च या सितंबर में.
ठीक है सर।
ठीक है, तो आप पढ़ना चालू कर सकते हो ना, आपको तो इजी रहेगा.
बिल्कुल
Guys, please leave your phone number and email in the chat box, so our team will connect to you one-on-one on video or audio, whatever you prefer, and they will give you all the information you need regarding the fees, scholarship, EMI, and all those things. So please give your name, phone number, or email address in our chat box. Or maybe there is a Arindam, is there a form is there?
We haven't attached any form, but we can.
Okay. I thought, okay, you just leave phone number, email, and name. So our team will connect you one-on-one. So they will give you more information. But you can, clarify your doubts with me or Dr. Sanika with us here. And regarding the fees, you can talk to our team.
Just a quick addition. If you are just add your country code and preferably your WhatsApp number. In case you're unable to reach out to you on calls because most of you might be busy, we'll drop you a WhatsApp, right, to connect and understand the best time to connect with you. Just try to drop in your WhatsApp number with the country code.
Yes, please. Phone number give with country code like 03. We don't know from which country. I know you are from Pakistan, but in generally, our sales team that we struggle a lot from which country, right? So please give like your country code and give your phone number, email. Yes, Dr. Lata, can you please unmute? Dr. Rohi.
Yeah, hi, sir.
Hi, how are you?
I'm good, sir. Thank you. Sir, I'm a BDS graduate from India.
Yes, Lata.
Hello. Yeah, sir, I have a few queries regarding this application, sir. And when I tried for apply registration process, I've found that under sub application type, there were 2 options like under registration type or registration and skills type, which I have to choose. And is there any specific importance for skills in that? And if you go for skills, do we need to submit any reference letters or such, sir?
I think basically, I don't know which option you are, our team has to see that thing. But in general, that you are overseas qualified, so you just need to choose that is skills one. Because once you pass the exam, they will give you the letter. Based on that letter, you have to apply for visa.
Okay, sir. Do we need to submit any specific letters? And I mean, like one of my friends who is working currently in Australia, she said like if we are going for skills option, then we are supposed to submit some reference letter, which is given by some doctors or some HODs like that.
Reference letter means that any work experience?
I'm not sure, sir. That's what I got confused, and I thought of asking.
I don't think so. Such, this is not for ADC. This is for anyone. We are providing a lot of, AMC and other exam. So they don't ask. Yes, if you are showing that you are working, you have some work experience. In that case, definitely you need to show that work experience from XYZ hospital you are working there or any clinic you are working. So from that letter you need to submit. Otherwise, no need. Yes, that you need that registration, and they might need good standing certificate from your dentistry council.
Yes, sir. Regarding good standing certificate is also I've got good standing certificate 3 months back. Does it have any expiry, sir? Like it is valid only for.
In general, 6 months.
So after 6 months, we are supposed to get a new good standing certificate, sir.
Yes.
Okay, okay.
Good standing
And
certificate for any healthcare professional. So in general, the 6 month the validity, because they want to check if there is any misconduct on
yeah.
something happened to your license or something. They want to check basically.
Okay, sir. Sir, I've got some gap of around 2 to 3 years after my graduation. Since I got married, I didn't work in any clinic. So, do they ask any certificate to fill the gap or some gap certificate
You have
like
to
that?
give the justification in your CV basically. So you can say it's very common in India basically, like after married girls are not working like in some time, right? Or maybe
Yeah.
sometimes the pregnancy and this and that. So female have a lot of the excuses you can give in that case.
Is that okay, sir? If I apply, or will they ask any particular certificates?
No, if they are, then you have to provide. We are not a government authority. We are an institute. Our job to help you to pass the exam. So in general, if you are, you have to provide a like detailed CV. In that,
Okay.
justified. Sanika, do you want to add something?
Yes, doc. Okay, so Dr.
Latha.
Lata. Okay, Dr. Lata, yeah. So could you please repeat your question? You were saying that you want to apply and you want to justify the 3 years gap?
Yes,
Yeah.
yes.
Okay, so actually, see the protocol for the skills registration, and as somebody asked before, you have to apply for both registration and skills assessment. Registration is only for countries who have a MOU with Australia. Those are UK and a couple of other countries. Basically, besides that, most of the countries around the world, you have to apply for registration and skills assessment. And Dr. Lata, coming back to your question, yes, you can, let's start with first applying. And they do ask you for a 2 years experience letter of, what you have been doing. So that can be definitely, if you have you been going to, any clinic even as a part-timer?
No, ma'am. I was just staying home. Actually, I got pregnant, and that was the reason I couldn't practice.
You can definitely write all of this in a reason, because they are definitely just, assessing your previous degrees to assess if you are eligible for the ADC exam in terms of credit match. So this won't even be a issue when you give the exam. You can definitely, explain that in a letter, and they accept all of this. Because their aim for the assessment is to, for you to be able to give the exam. And once you pass the exam, then it starts from a different road.
Okay.
Okay, so this is like easily justifiable.
Okay, ma'am. And I have one more doubt, ma'am. I mean, like, I've got different names in my passport and also in my certificates. I mean, BDS certificates. So, will they ask for any name change certificate or something like that, or do they accept it?
Yes, they may ask basically. In general, we are dealing with different bodies in Australia. So they always, if, for example, someone's name is like Muhammad, full form in passport, but in mark sheet it might be MOHD, or maybe only M dot. For example, in South India, this is like this. So sometimes they may ask you to provide a letter from your college or university. So they can say these are both person. This is the passport number. Is the person is the same, like this. Or maybe sometimes you can get a letter from if you are from any village or something. Is there any government officer? Yeah, they can give a letter or something. They may.
Okay.
It is not compulsory.
Okay, sir. And sir, few months back, I mean, in last November, I've given my IELTS and got a score of 6.5. So, if I repeat the IELTS and if I get a better score, I'm a eligible score of 7. Do I need to give IELTS again after the ADC exam, or
No.
they'll accept it?
If it is not expired, you can. Even in Australia nowadays, if you are given in a two sitting also, they are accepted. The two sitting means, for example, you score 6.5 in one component, in other component you might be have 7. So that specific component you can repeat nowadays for in IELTS.
Yes, sir, yes. So this is general IELTS, right? We have to clear general IELTS only.
Academic.
Academic, okay.
Tanika, academic. Basically, anyone is doing for registration purpose, any healthcare professional with APRA. You have to go with academic one, not general. General one only for visa purpose. Like for example, someone is an engineer,
Okay.
and that guy can go for general one because he just needs the visa. He's not going to sit in any exam. He's not going to register himself as a a professional or something. So for them is general, but for us as a healthcare professional, we need academic one.
Okay, sure. I mean, like,
Dr.
I got
Akram is
confused.
right.
Okay.
Yeah, and Dr. Akram is exactly right. So when you give the exam, the only factor is required is the academic one. So initially, whole procedure and apply for your visa or your PR purposes, it's the general one. Because right now they're assessing your degree and your skills, right? So it is
Yeah.
definitely academic.
Okay. Okay.
Okay, thank you, Lata.
Thank you so
Yeah,
much, sir. Thank you, ma'am.
Rohit. Dr. Rohit, can you please unmute? Dr.
Yeah.
Ariba. Umair Ayub.
So the experience needed is 2 years, sir.
Sanika. Work experience for 2 years or this is not a, she have basically 3-year gap basically. In that case, they will ask, the gap you have to justify.
I am a postgraduate, no, sir. So will this post-graduation be considered as an experience, or
Yes,
do I need?
experience basic, definitely. I mean, but this you are doing continuously. If someone is not doing anything, he is not practicing, he is not studying. In that case, you have to justify what was you are doing in last 2 years.
Okay, sir. Okay.
But you are studying, so for you is not applicable for you.
Yeah, yeah.
Okay, sir. Assalamualaikum.
Umair.
सर माय क्वेश्चन इज कि मैंने काफ़ी लोगों से सुना है कि ऑस्ट्रेलिया जो है दे डजंट अलाउ या मे बी इट माइट बी अ मिथ कि
अभी साफ नहीं आ रही है. Your voice is
hello.
Yes, your voice is not clear.
No, up clear, sir.
Yes, little bit.
Okay, so my question is कि मैंने काफ़ी लोगों से सुना है कि ऑस्ट्रेलिया जानबूझ के क्लियर नहीं करने देता पाकिस्तानी ग्रेजुएट स्टूडेंट्स को. इज इट ट्रू और जस्ट अ मिथ?
बेसिकली ये कंप्यूटर है, वो देखता नहीं है कि तुम हो कहाँ से. डजंट मैटर कि यू आर फ्रॉम कंट्री. सो ये कोई एक्सक्यूज नहीं है. हम दिस इज द सेम वन ऑफ आवर स्टूडेंट, हिज नेम इज अहमद. ओके, सो ही argued with before he joined us, he talked to me with his visas. He also saying same thing. Sir, Pakistanis will get visa after 36 months or something. A long queue, long waiting is ongoing. So I told him this is not the case. You pass the exam and file it. So he got the visa in 45 days. वो नेशनलिटी देखते हैं कि आप कहाँ से हो, और वो उनको एग्जाम उसको पता भी नहीं कंप्यूटर को आप कौन सी नेशनलिटी के, आप इंडियन हो, पाकिस्तानी हो, या आप कहाँ से एग्जाम दे रहे हो, डजंट मैटर.
अच्छा, तो सर मैंने काफ़ी अच्छा हो गया, मैं काफ़ी रिसर्च कर रहा था इसके ऊपर कि मुझे कोई पाकिस्तानी ग्रेजुएट मिल जाए, बट मुझे इंडियन काफ़ी मिले, बट पाकिस्तानी कोई नहीं मिला इन ऑस्ट्रेलिया ना. तो दैट्स व्हाई आई वाज लाइक
आप पहले पाकिस्तानी बनो, सबको आप बताना.
ओके.
यस, आप पहले ज्वाइन करो, एकेडमिकली पास करो, फिर आप दूसरे लोगों को बताना.
ओके, जरूर, इंशाल्लाह. अच्छा, तो सर माय सेकंड क्वेश्चन है कि अगर हम डायरेक्ट एमपीएच की डिग्री में अप्लाई करते हैं तो क्या ड्यूरिंग आवर स्टडी तो हम उधर एज अ डेंटल असिस्टेंट, डेंटल हाइजीनिस्ट के तौर पे काम कर सकते हैं? और सेकंड
कंपनी क्या है, नाउ यू अप्लाई एंड पास ADC 1 and then come on MPH, come to do MPH. Okay. So simultaneously you can work as an assistant, you can earn money, and you can get in Australia, and then you can write the part 2. cost.
Okay. And that would be like paid job or just a shadow?
नथिंग इज फ्री इन ऑस्ट्रेलिया. यहाँ पर जो वो होता है ना, आई मीन क्या बोलते हैं उसको, आई मीन चौकीदार, समझते हो चौकीदार?
Yes,
तो
yes.
यहाँ पर जो है
Of course.
$30 मिलते हैं पर घंटा के हिसाब से, $35 मिलते हैं पर घंटा के हिसाब से ऑस्ट्रेलिया. तो यहाँ पर कुछ भी फ्री नहीं रहता. यहाँ कुछ भी काम कर लोगे
Okay.
पैसे पैसा है. यहाँ पर ऐसा नहीं होता कि यहाँ पर जो है ना कि भाई आप फ्री में कुछ काम रेंट नहीं चाहिए फ्री में या कुछ है. नथिंग इज फ्री इन ऑस्ट्रेलिया.
ओके. और सेकंड सर थर्ड वन इज के अगर हम उधर एमपीएच डिग्री क्लियर करते हैं और बाय एनी चांस हमारा पार्ट 2 नहीं हो रहा होता है, तो हम उस टाइम के दौरान ड्यूरेशन ऑफ दैट से हम एज अ एमपीएच, जाहिर बात है हमारी एमपीएच क्लियर हो गया तो हम पब्लिक हेल्थ में एज अ वर्क काम कर सकते हैं. तो
Yes.
इसके लिए एक्स्ट्रा
अगर आपको जॉब मिल जाती है तो आप कुछ भी कर सकते हो.
ओके, सही है.
Basically, MPH is a full-time course, 2 year ka, right? So if you complete this MPH, you can work full-time. You have full work right. Even you complete this course, you will get another 3-year work visa called post-study working visa, PSW visa. You will get. So basically, you have around 5 years, total time. That's why I'm saying, prepare, start now. Type to this sit in part 1 in your home country, and then come to Australia. And MPH also we can have admission.
पाकिस्तान में कितने सीट्स हैं पार्ट 1 के लिए?
पाकिस्तान इंडियन क्वेश्चन भाई, ये तो फीस डॉलर में है. आप किसी भी कंट्री से हो, डजंट मैटर, आपको सेम फीस पे करनी होती है ना?
नो नॉट फी. आई मीन कि सीट कितनी है, कि कितने स्टूडेंट अप्लाई कर सकते हैं फॉर पार्ट 1 इन पाकिस्तान?
अरे मैं ऐसे ये कोई ऐसा नहीं होता. ये कोई ऐसा क्वालिफिकेशन नहीं होता. कितने कोई ऐसा कोटा थोड़ा नहीं है इसका कोई. There is no such quota country wise कि भाई 5 लोग ही बैठेंगे पाकिस्तान से, 10 लोग बैठेंगे इंडिया से. ऐसा कोई कोटा नहीं होता.
जितना होता है ना वो वाली के लिए वो फॉर दैट.
नहीं, ऐसा कोई कोटा नहीं होता. सिंपल जो वीजा होता है वो किसी भी नेशनलिटी का हो, वो सबके लिए सेम रहता है.
और सर एमपीएच का जो होता है वो भी इनके पीआर के अंदर स्कोरिंग पॉइंट्स में इंक्लूड होता है या नहीं?
नहीं, उसका कोई वो पीआर की लिस्ट में आता ही नहीं है. एमपीएच
वो आता ही नहीं है. ओके. और लेकिन अगर हम एमपीएच क्लियर करके एज एमपीएच कोई जॉब ले लेते हैं तो फिर हमारा पीआर वो काउंट हो जाएगा क्योंकि हमें जॉब मिल जाती है.
वो लिस्ट में है ही नहीं तो पीआर कहाँ से होगा? जॉब मिल जाएगी, वो वर्क वीजा पर रहोगे आप.
वर्क वीजा पे रहेंगे. ओके, ठीक है. थैंक यू सर.
ओके, थैंक यू.
ओके.
पीआर तभी मिलेगा जब आप एडीसी क्लियर करोगे या कोई दूसरा वो. पब्लिक हेल्थ तो उस लिस्ट में आता ही नहीं है. पीआर की लिस्ट में नहीं आता पब्लिक हेल्थ.
कौन सा सर आ जाता है हमारे रिलेटेड होगा?
सर
2070 से इसको रिमूव कर दिया है. यहाँ पर लोग भर के आते हैं. इस्लाम यहाँ बहुत लोग आते हैं. एमबीबीएस वाले, फार्मेसी वाले, नर्सिंग वाले, डेंटिस्ट्री वाले, सारे के सारे लोग एमपीएच करते हैं. तो एमपीएच का कोई ऐसा वो स्पेसिफिक बंदा इसी की नहीं करेंगे और उसको वीजा देंगे. यहाँ इतनी डिमांड नहीं है आजकल इस कोर्स की. मगर हम बेसिकली टू पास दिस एग्जाम, so easier for you to pass part 2. Yes, Mohammed Ibrahim.
Yeah, sir, I'm Dr. Nazish from Karachi. I've done my BDS in 2013, and since then I've been, working in the clinic for about 4 to 5 years experience. So can I apply
Yes,
for this test?
definitely.
And
Yes, definitely.
and the gap years I have, I got I got my house job done in 2015, and then I started my clinic in 2017. For the 2-year gap, there is a 2-year gap in from 2015 to 2017.
In general, they see work experience last 5 years. Last 5
Yes,
years.
I've been working in a clinic.
Yes, that's good. अगर आप basically they will see in last 5 what you're doing, तो उसमें अगर आप काम कर रहे हो तो आप there's no problem.
अच्छा सर, मतलब it's just a small clinic और छोटा सा हॉस्पिटल है, तो मतलब is it worthy?
Yes, अगर ये सीट का भी अगर क्लिनिक है छोटा मोटा भी doesn't matter, कि वो गवर्नमेंट अप्रूव था भाई, अपनी क्लिनिक चल रही है.
हाँ, एग्जैक्टली. जी.
कुछ नहीं चाहिए.
अच्छा, तो स्टार्ट करने के लिए how do we have to apply for it, and just explain the start?
Yes, you just leave your phone number, email in our chat box, so our team will connect her tomorrow morning. Okay. So
Okay.
they will
Thank you,
help
sir.
you complete your full process. Okay.
Okay. Okay.
Yes, next please.
Okay, sir. Just one more thing. Will there be any guidelines or preparation that you'll be,
That's why we are providing 4-month coaching, so we will provide A to Z assistance.
Yes, that's okay. Thank you, sir.
Yeah, thank you. And we have like mobile application. We have you can watch in laptop, mobile, iPad, tablet, whatever you have any device, so you can attend live classes. Live classes and have plus recorded. So if you miss any class and you are working, right, still you will get the recorded session. Please leave your phone number, email in the chat box, so we can connect you. Yes. Tapat.
Hi, sir.
Hi.
Sir, I'm from Pakistan. Basically, I'm currently in the final year of the BDS. तो मेरे 2-3 सवाल हैं कि first ये कि where will be the part 1 will be conducted for the Pakistani students and where will be the part 2 will be conducted for the Pakistani students.
पाकिस्तानी तो लेना देना नहीं है यार, बता नेशनलिटी भूल जा मेरे भाई, ये इंटरनेशनल काम होता है। तो बेसिकली
तो पार्ट 1 कहाँ पे कंडक्ट होगा फिर?
पार्टी इन जनरल अपने होम कंट्री में होता है। अब अगर आपके यहाँ पे अगर सेंटर नहीं होगा तो आप नियर बाई कंट्री में जाओगे, फॉर एग्जांपल दुबई में होगा या किसी गल्फ कंट्री में होगा। इंडिया में तो सेंटर है उसका, है ना। तो अरिंदम, इसका पाकिस्तान में सेंटर है क्या, चेक किया था क्या?
नहीं सर, पाकिस्तान
में नहीं है। नियर बाई सेंटर फॉर पाकिस्तान इज दुबई और सिंगापुर।
हाँ, तो दुबई सिंगापुर आप जाओगे एग्जाम देने को, अगर वो तो जैसे आपकी कंट्री में सेंटर ही नहीं है, लोग ही नहीं बैठते आपके यहाँ से एग्जाम में, तो सेंटर कहाँ से देंगे वो? जब अभी कौन बोल रहा था कि सर एक भी बच्चा मुझे मिला नहीं पाकिस्तान से, जब बच्चे बैठेंगे नहीं तो सेंटर क्यों देंगे आपके लिए वो? जब बच्चे सेंटर मिलेगा, तो यही तो पॉइंट है बेसिकली। अभी फार्मासिस्ट का लास्ट ईयर एक सेंटर था पाकिस्तान में, अभी 4 सेंटर कर दिए, बिकॉज बहुत सारे फार्मासिस्ट जो पाकिस्तान से एग्जाम को फिल कर रहे हैं उसके लिए, उनको मालूम है डेटा उनके पास में आ रहा है, कोई बहुत सारे लोग बैठ रहे और सीट नहीं मिली, इसलिए उनको जो है सेंटर बढ़ाना पड़ गया। डेंटिस्ट्री में कोई बैठ नहीं रहा है वहां से एग्जाम में।
सर एक और क्वेश्चन है कि पार्ट 1 के बाद आपका आइल्स कोर्स कंसीडर किया जाएगा?
यस, आई मीन बिफोर भी दे सकते हो आप,
बिफोर भी दे सकते हो, वो एक्सेप्टेंस होगी उसकी।
वो बेसिकली 2 साल की वैलिडिटी होती है ना इंग्लिश टेस्ट की।
ठीक। और वो आप 2 साल में जब भी आपका पार्ट 2 और पार्ट 1 जो होगा उसके बाद पार्ट 2 आपका कितने मंथ्स के गैप के बाद होता है?
वो इन जनरल सनिका, हाउ मेनी टाइम दे कंडक्ट फॉर द पार्ट 2 जनरली? 2 टाइम?
नहीं, पार्ट 2 डॉक हाँ, और डॉक्टर सर तक जो हमारा पार्ट 2 है वो ईयरली 4 टाइम्स होता है, बट पार्ट 1 2 टाइम्स होता है। सो एक बार आपने पार्ट 1 क्लियर किया, मान लीजिए आपने मार्च में किया, तो आपके अप्रैल में पार्ट 2 का एग्जाम होता है, बट तब तक आप प्रिपेयर नहीं हो सकते 1 महीने में ना, तो आपको भी वो 3-4 महीने का काम आ ही जाता है। इस बार आप
4 बार हो रहा है,
पार्ट 2 होता है 4 बार
कि आपको जो नेक्स्ट जब भी होगा जून के आसपास होगा, आप उसमें देना 3-4 महीने का स्टडी करने के बाद पार्ट 2 को।
श्योर सर, थैंक यू।
यस नूर
जी, आप लोग प्रैक्टिकल के लिए कुछ कोचिंग देंगे सर?
यस, पहले जो लोग पास करेंगे पार्ट 1 उनके लिए तो कोचिंग देंगे, तो पहले तो हम लोग पार्ट 1 ही करा रहे हैं ना, तो ये एग्जाम ये मार्च में होगा नेक्स्ट ईयर, और जो लोग पास करेंगे पार्ट 1 तो डेफिनेटली विल स्टार्ट फॉर पार्ट 2।
ओके, तो यू हैव सेंटर्स इन इंडिया फॉर दैट?
नहीं, पार्ट 2 तो ऑस्ट्रेलिया यू नीड टू कम
जी। ऑस्ट्रेलिया में तो एग्जाम देना है, मगर प्रैक्टिस तो पहले थोड़ी बहुत इंडिया में करेंगे ना बिफोर कमिंग टू ऑस्ट्रेलिया।
वो तो आप अपने घर पर ही करिए, जो भी जहाँ भी आप क्लिनिक में कर रहे हो, है ना। वो ऐसे तो यहाँ वो नहीं कर सकते हम लोग। हाँ, ऑनलाइन जितनी हो सकती है हेल्प वो करेंगे इन जनरल पार्ट 2 में, और लेट्स सी कि हम लोग अगर वहाँ पर कोई सेंटर खोल सके इंडिया में। इसलिए अगर लोग ज्यादा होंगे तो डेफिनेटली हम खोलेंगे। अब 2 4 5 10 लोग हुए पूरे इंडिया में, एक कोई केरला में, एक कोई हैदराबाद में, एक कोई दिल्ली में, तो हम कहाँ का सेंटर खोलेंगे अपना, राइट?
सही है, सही। जी सर, ओके, थैंक यू सो मच।
Thank you. But definitely, we are providing the courses for all healthcare professionals like AMC for medical doctors. We are running right now. अभी हमारा 4th बैच चल रहा है उसका, है ना। तो ऐसे कैप्स का शायद 6-7 में हमारा बैच चल रहा है उसका। तो ऐसे बहुत सारे कोर्सेज हमारे पास में ऑलरेडी हैं। तो हम लोग बेसिकली स्टार्ट करते हैं 1st से। अब प्रॉब्लम ये है डेंटिस्ट्री का एग्जाम ही 2 बार होता है, जैसे फिजियोथेरेपी को होता है 4 टाइम, एएमसी जो डॉक्टर है एमबीबीएस उनको होता है 10 टाइम्स। तो उन लोग को बहुत ज्यादा वो एग्जाम उनको होते रहते हैं, फ्रिक्वेंसी उनकी बहुत ज्यादा होती है। अब डेंटिस्ट्री 2 बार ही होता है 1 साल में, राइट? तो उसके बाद में हम लोग डेफिनेटली पार्ट 2 को स्टार्ट करेंगे, जब ये जो लोग पास करेंगे पार्ट 1 से।
सर एक चीज मुझे पूछनी थी कि मैंने अभी लास्ट सितंबर 2022 में वो दिया है IELTS एकेडमिक्स, ठीक है, और 6.5 मेरा स्कोर था। लेकिन अगर मैं मार्च में दूंगी तो जब तक मेरा वैलिड होगा, मतलब अभी तो सितंबर तक तो वैलिड होगा, लेकिन ये है कि वो फिर जैसे पार्ट 2 से पहले तो एक्सपायर हो जाएगा।
पहली बात तो आपको 7 चाहिए, 6.5 से काम चलेगा नहीं आपका।
अच्छा, एकेडमिक्स 6.5 है मेरा।
हाँ, तो 7 चाहिए उसमें, आपको देना दोबारा पड़ेगा।
ठीक है, ठीक है, ठीक है।
ये आईएलटीएस जो अगर आईएलटीएस आपको थोड़ा टफ पड़ रहा है तो आप चले जाओ ओईटी पर। हम लोग प्रिपरेशन कराते हैं ओईटी की और पीटी की, और आईएलटीएस भी हम लोग कराते हैं बेसिकली, हमारे सारे स्टूडेंट्स को। तो जिसका अगर 6 आ जा रहा है आईएलटीएस में, तो मैं तो हाईली रिकमेंड करूंगा कि आप चले जाओ पीटी पर या ओईटी में, तो आपका 7 इजीली आ जाएगा। या फिर आप ट्राई करो, मेहनत करो, उसमें आपको 7 आ सकता है जो आईएलटीएस में भी।
सर माइंड क्वेश्चन एक और था कि एडीसी पार्ट 1 के बाद एक क्वेश्चन अभी पूछा गया था कि अगर आप पार्ट 2 के गैप में एमपीएच के लिए अप्लाई करते हैं एज असिस्टेंट, तो एमपीएच के अप्लाई करने के लिए क्या रिक्वायरमेंट है? बीडीएस ही रिक्वायरमेंट है या उसके लिए अदर रिसर्च वगैरह भी होनी चाहिए आपकी?
ओनली बैचलर डिग्री रिक्वायरमेंट होती है, कोई भी बैचलर डिग्री हो उसके बाद आप अप्लाई कर सकते हैं।
ठीक है, श्योर सर, थैंक यू।
सर एमपीएच के लिए गैप ईयर्स तो काउंट वो होता है ना, जस्टिफाई करना पड़ता है। जैसे मेरा गैप है 2013 से, तो एमपीएच के लिए अप्लाई करने के लिए
लास्ट 5 ईयर में आप दिखाओगे। आपकी एज कितनी हो गई है?
मेरी 34।
स्टूडेंट वीजा में एज बहुत मैटर करती है अगर यार किसी एज 40 है, वो बोले मैं स्टडी करने आ रहा हूँ, तो भाई उसको बोलेगा यार ये क्यों पढ़ना आ रहा है 40 ईयर की एज में, राइट? तो अगर आपकी 34 हो गई स्टिल आपको, आई डोंट थिंक तो कोई प्रॉब्लम है। आप 5 ईयर से आप बेसिकली प्रैक्टिस कर रहे हो, तो आप बोल सकते हो हम जो है पब्लिक हेल्थ रेलिवेंट सब्जेक्ट है, तो आपको एडमिशन मिल जाएगी, उसमें प्रॉब्लम नहीं होनी चाहिए।
ओके, थैंक यू सर।
Hello, sir.
How are you?
I just finished my BDS, and does we really need 2-year experience to apply for that exam?
Sanika, are you here? Is the Dr. Sanika, are you here?
Yes, sir, I'm here.
No, I'm just asking to our lecturer,
She's on mute, I guess. Dr. Sanika, if you can unmute yourself. You're on mute.
Yes. Yeah.
Sanika, this is like, कि ये वो हो गया कि 2 year वाला एक्सपीरियंस मस्ट है क्या, या एक्सपीरियंस नहीं चाहिए?
2 years एक्सपीरियंस मस्ट है। बट अगर आपने पोस्ट ग्रेजुएट डिग्री अपनी बैचलर्स के बाद करी है, तो यू कैन यूज दैट आल्सो एज वर्क एक्सपीरियंस की दिस इज माय एक्सपीरियंस, इट वाज इन एडिशन पार्ट ऑफ माय पोस्ट ग्रेजुएट डिग्री। सो आप पोस्ट ग्रेजुएट डिग्री वाले एक्सपीरियंस को वर्क एक्सपीरियंस कन्वर्ट कर सकते हैं, बट आपको 2 years का एक्सपीरियंस चाहिए है।
Okay. So like I heard like once you clear part 1, you have like a specific amount of time to clear part 2. So like
3
is
years,
there like specific deadline?
Yeah, the time period is 3 years. So once you clear part 1, you have to clear part 2 in a span of 3 years. But 3 years is a long time, so for somebody who has cleared part 1.
Actually, I just checked basically on website, so I don't think so there is a 2-year experience required. So if you go here on ADC website, that clearly mentioned that you must have a 4-year degree from the university and have held a full and unrestricted registration. Experience is not required basically to 2 years.
Okay, so I'd like to add this, that sometimes what happens is you finish this, like most of the people that have been applying right now, what they don't mention on the website, but they do ask you of any kind of work experience. Even if you've just passed out, it's 4 months, you start, you give that. Basically what they're trying to do is to see that, passing out of your country, have you got any experience of your own country's dental procedure? That is what they are asking. It is not 2-year experience per se. The email that they send to you, it states 2 years, but as a reply to that email back to ADC, you can give any amount of experience and they accept it.
Actually, in general, basically in Indian degree or Pakistani degree, they have 1 year internship, right? This is also a kind of experience. Okay.
Yes, definitely.
But if you finish, so it means that you must continue work. not like, if someone have like a 10-year gap, 10-year back, they study in last 5 years, they are working, in that case, it's fine. You have a 5-year work experience. But if you are a fresh here, so there is no gap basically. If there is a 3 months, 6 months, 4 months, you continue need to work. This is what Dr. Saling is trying to say.
Yeah,
But
and I'd like to add one more thing also, that if, as just Dr. Akram opened the initial assessment page, it states clearly you need a 4-year postgraduate degree. So the 5th year of your bachelor's of dental surgery is also counted as work experience. Precisely why when I'm saying that they sent you an email back saying that you sent us work experience, any amount, even for 4-6 months that you send, cumulatively it becomes more.
So in general, like Indian graduate, they have 1 year experience.
Yeah.
Will count as a work experience basically,
Definitely.
Yes.
So, ma'am, like in terms of difficulty, like how difficult is this exam?
I mean, Jack Ma, I mean, this is like, so if you are, I can say, yeah, definitely little bit tough exam, not easy exam. But, lot of doctors are passing this exam. I can see around my area, lot of Indian doctors, here in the Indian Pakistani, they are practicing here, AMC, ADC, they are passing. So I can say it's like not like something like impossible thing. You can definitely can pass, but need, from your side, commitment at least, whatever we are going to finish, and you have to cover all those things. So I can say like not very hard, not like impossible thing. Yes, but this is not very easy exam also.
Okay, sir. Thank you.
Thank you. Like mediocre exam, I can say. Yes, next please. Mohsen, Ali Mohsen.
Assalamu alaikum, sir.
Walaikum salam.
I'm Dr. Rayur from Pakistan. I've completed my BDS in July and I have 1 year experience house job. And I want to appear in the March intake. Can I appear in the March intake? I haven't done my initial assessment yet.
Yes,
Can I?
Yes, you can.
After doing initial assessment, can I, take exam in the coming intake?
Yes. I mean, there is a lot of time you can. So you just leave your phone number, email in our chat box. Our team connect to you tomorrow. So try as soon as possible because it takes time for skill assessment. Okay.
And I have also applied for MPH in Australia, and I've got the offer letter. I'm gonna apply for the visa soon.
Which uni?
Macquarie.
Macquarie, you are coming Sydney.
Yeah.
Sydney is just a very nearby this Macquarie uni from our office. Okay. Yeah.
Okay.
So Mohsin, I mean, you already applied MPH. So now try as soon as possible. You start your skill assessment. So you can sit in the March exam. We are going to start this batch very soon, So start prepare yourself. So definitely, you pass this. You are coming basically February intake to Australia.
Yeah.
You can write this exam in Australia and pass the exam. Then immediately you can start working as the assistant dentist, and simultaneously you can prepare yourself for part 2. So it is easier journey for you.
Yeah, that's why that is why I've applied for MPS. And sir, one more question is that how much time exactly should I study before appearing in the exam? Because I haven't started preparing yet.
No,
I want to appear.
There is no such formula because same content. Some people might need to study 1 hour. Some might need maybe 4 5 hours.
Right.
But
Get your point, sir.
I can say if you are given like 4 hours per day for at least for 4 months, you can. Yeah.
Okay. And so one last question that I want to ask is that I have just 1 year experience of house job after my BDS and about 6 months of experience in a private clinic in my country. So is that good enough for appearing in part 1 exam?
Yes, definitely. Work experience is not mandatory, as I just show you,
you
can. But you did 1 year that housemanship. That is your work experience basically.
Yeah.
So no problem.
Yeah. Thank you very much, sir. Thank you. I'll leave my email in inbox so you can.
Your WhatsApp number basically with your country code, and then we'll connect to you tomorrow.
Sure. Thank you very much, sir.
Thank you. Yes, Athila PT. Can you please unmute yourself?
Hi, sir.
Yes.
Sir, I just completed my BDS last May. So am I eligible for attend this ADC exam?
Yes, definitely. What are you doing currently?
Now I'm practicing.
Yes, then you are eligible, right?
Okay, thank you, sir.
Thank you. Yes, Sarah. Yes, Ruhi.
Evening, sir.
Evening.
Sir, I need to ask which part is the most toughest, part one or the second one?
Obviously, second one.
Okay,
Second
we
one,
have to
actually,
perform procedures like.
second one is for everyone. This is not for dentistry. Whether you are any medical doctor, dentist, pharmacist, nurse, because everyone has to go for two exams. And part two is the OSCE exam, or we can say a clinical exam or practice exam. Not a little bit
Yes.
hard as compared to part one.
Okay, we have to perform the procedures like. Can you tell?
Have you attended any OSCE? Are you from which country?
I'm from Pakistan.
So this is the main problem, Pakistan or India. OSCE वहाँ पे होता नहीं है. I mean any medical college in our system basically. But in high income countries, whether it is US, UK, Australia, तो ये लोग के यहाँ पर पार्ट टू जो होता है वो OSCE एग्जाम होता है, OSCE, ठीक है. तो इंडिया में सेवरल स्टेशन होते हैं वहाँ पर, और उस पर फिर आपको जो है एक जगह पेशेंट होगा, उसकी प्रॉब्लम अंडरस्टैंड करनी होती है, फिर उसको जो ना उसको प्रॉब्लम को सॉल्व करना होता है. इस टाइप के कुछ केसेस दिए होते हैं आपके लिए. Dr. Sanika, are you here? Sanika, if you can just give a little bit brief about
Yes.
Dr. Sarah.
Yeah. Could you please repeat your question?
He's asking regarding part two. So
Part two. So,
yeah,
obviously part two is a little difficult. Yeah, it is, more difficult as compared to part one. And
I need to ask, we have to perform procedures over there or just the diagnosis or the treatment plan?
There are, total 16 stations. There are little tasks that you have to do. So in cumulative, there are 16 tasks. Some of them are just for, the demo, like you'll be giving topical LA or, you'd be preparing a MO cavity. So those are the practical ones. And some are communication based where they basically check your English.
Okay.
So it will be like, the physician will come and hi doctor, today I have a complaint of pain. And they know how that communication goes and what your diagnosis becomes. So they will check both your thought pattern and your practical skills with the thought patterns.
Okay, practical skills we have to perform. They can ask for some prosthetic procedures or.
Yeah, those are also divided. You have, from as simple as placing a rubber dam to as difficult as giving a block or giving a infiltration. Then the maximum it goes down to is a MO cavity, amalgam filling, and then there is the last one that is the axis opening of a single, rooted teeth like a canine or a central incisor. So that's the difficulty scale basically.
Thank you so much. Thank you.
Yeah. Okay. Thank you for your question.
Next, please. Ruhi.
Good evening, sir. So my question was, what is the further scope once ADC is cleared? Like in the ADC website portal, they have given that we can either practice in general as a general dentist or general therapist or as a dental prosthesis. So
yes, so you have to work as a general dentist. In India और पाकिस्तान अपने यहाँ पर क्या होता है in generally, कि जनरल डेंटिस्ट की शॉप होती है, क्लिनिक होती है, वहाँ पे जाते हो आप. So same like here.
Okay, so like for example, if we want to pursue something like we have to pursue something else, we have to do further studies. Is there doctorate degrees available that we can do?
Yes, definitely. You can do master, PhD, whatever you want, you can.
In any field that we like.
Yeah. In India also, you are Indian or Pakistanis?
Indian.
So in India, are you getting any clinical branch? Getting a clinical branch is very, very tough in India. You are Indian citizen, right? There is same like in Australia. there's a competition is there. So there is no such kind of, I want this branch only, and then I can do. So if you are deserved for that branch, definitely you will get, so you have to go in the competition when you are going for higher studies.
Right. So there is another entrance exam do we have to give when we are going for?
Each university have their own entrance exam. Sometimes they have interviews also. For example, University of Sydney. I'm a lecturer there. So for there we have one of the oldest dentistry school. Okay. In dentistry school, medical, pharmacy, this is the oldest university in Australia, University of Sydney. So if someone is going for that university, definitely there is a very one of the toughest exam. Same like someone want to go in to study in AIMS Delhi. So they are obviously very difficult to get the admission. There are so many other medical colleges in India, easily they can get. That's same like in Australia. Like if you are going any mediocre university, small university, definitely easier for you. But if you want top university and top medical college, so definitely is difficult. And here is the not like in India. India might have like the same exam for everyone, like like a country wise, like NEET, PG kind of things, right? But here each university have their own exam. There is no such nationwide exam.
Okay. Thank you, sir.
Thank you. Yes, next please.
Hi, sir.
Yes, Dr.
Sir, I've recently applied for Saudi dental exam, but it got rejected saying that I was supposed to have 5+1 years of certificate. But in India, we only have 4+1, that is 4 years of education and one of
Saudi
interview.
Arabia changed the regulation. So in the world, basically Saudi is following the US regulation. So in US, even for pharmacy, there was a 4-year degree earlier before 2019. After 2019, they changed the regulation. Now they want a minimum 5-year degree, whether it is pharmacy, dentistry, even they are asking for nursing also. Even nursing, we have only 4-year degree in India. तो उनको लोग अभी चाहिए नहीं, तो बेसिकली उन्होंने ऐसा चेंज किया हुआ है. बट इन जनरल इन ऑस्ट्रेलिया क्लियरली मेंशन 4-year degree is enough for Australia.
Yeah, yes, sir. Then when I got my application rejected, I contacted one of the persons I knew from council. Then he said, like, once your application get rejected, you're not supposed to apply for any of the Gulf countries again. I mean, like, it will be permanently rejected and I can't reapply. So is it the same way with Australia? If any of my certificate get rejected, can we update it and reapply?
They are not stamping on it. Even Australia does not want your original document. They just want your scan copy. Gulf countries want basically you have to go Ministry of External Affairs, go and stamp your mark sheet, your degree, then you have to send, So Gulf countries have their own, regulations, but here not such kind of. These are high income country you are applying. US, Canada, UK, Australia, Europe. Don't ask this such shit, all those things. No worries about this, okay, they reject it. And as I mentioned that, for example, pharmacists in the worldwide, I'm a pharmacist, so I have a lot of, regarding this, I every day I make content, make a lot of the questions I receive. So US required 5-year degree, Ireland required 5-year degree, and Saudi Arabia required 5-year degree. Apart from these 3 countries in the worldwide, they can practice and work. So same for dentistry. Okay, so you can work anywhere. You can go even Canada, you can come Australia, no problem, no worries about this.
Okay, sir. So even if my any of documents get rejected, I can update them and reapply. There is no such thing as like a permanent rejection.
अरे भाई हिंदी समझ में आता है आपको, मैं बोल रहा हूँ उससे लेना देना कुछ नहीं है, वो आपका देखेगा ही नहीं. They are asking your not asking your original degree. They are asking your scan copy only. और उसने they are just saying you are not eligible because you are 4-year degree.
Okay, sir. Okay.
तो आप एलिजिबल 100% ऑस्ट्रेलिया के नहीं है, तो नो वरीज. इवन ऑस्ट्रेलिया रिक्वायर्ड 4-year degree ओनली. उसने रिजेक्शन आपने खाली क्वालिफाइंग किया बिकॉज यू आर नॉट एलिजिबल टू सिट इन दैट एग्जाम फॉर सऊदी एग्जाम. उसने इसलिए नहीं किया कि अगर आपने कुछ ऐसा कुछ क्राइम कर दिया, कुछ कर दिया कि आप दूसरी कंट्री में आप जा भी नहीं सकते. तो ऑस्ट्रेलिया को 4-year का डिग्री चाहिए, यू आर एलिजिबल फॉर दैट. कोई भी इंडियन डिग्री है, पाकिस्तानी डिग्री है, 100% एलिजिबल है ऑस्ट्रेलिया के लिए. ये 4-year की डिग्री चाहिए. सऊदी में का उनका अलग ही रेगुलेशन चल रहा है, वो यूएस को फॉलो कर रहे हैं वो लोग.
Okay, sir. Sir, and this good standing certificate, you say, I mean,
You have to apply to the Dentistry Council, where you are dentist.
Yes, sir. I have got a certificate with me, but someone said like the council has to directly submit it to the ADC,
Yes, so,
or
yes, so you can. I mean, it's very easy. You just pay the fees for your council, and council will directly send to the to ADC.
okay. After filling the registration form, we have to submit this good standing certificate, or prior only we have to do it, sir.
After only in general, or maybe all together. Sanika, when they need this good standing certificate, is it at the time of APRA or just for skill assessment?
No, they need it for skills assessment also. Like when you apply for the exam, they need your, good starting certificate
So
from your
you
council.
need to send directly from council?
Yeah.
Okay.
And these days they don't send it by email. They just they don't send it by mail. They just email. So what you do is you go there and you tell them this is the email ID of the ADC council, and your council will send the email from the registered email ID. That is literally how ADC receives the good standing certificates.
So they have, nowadays it's very easy. So they can just send the email.
Sir, I guess there is a person in our on the chat box. Tarannam Sheikh. She has a question for the faculty. Dr. Sanika, if you can answer the question. There is a question for you on the chat box.
Want to leave fellowship is valid? I mean, I don't think so. Sanika, can you able to see this?
Yeah, what type of international components of oral implantology and fellowship of ICIs valid? These are just, fellowships or maybe memberships of small congresses. This has got nothing to do with the exam.
Even if you have any US Congress and UK Congress, doesn't matter.
Yes.
You are trying for your registration, so they have to see their own regulation. It cannot help you, anyway. They might help you to get a job as a faculty or something once you registered dentist, but not help you, in this registration process. No,
sir.
No benefit. Yes,
sir.
Yes,
So, like, is there a way to get sponsorship for dental hygienist and come there?
Are you a dental hygienist? Is very difficult. First, you have to apply for assessment. It's difficult basically nowadays. Very easy to come, to pass ADC2 or come to on a study visa. Some of them are coming like to doing here MPH.
So, like, after clearing part 1, and how do we come for part 2? Like, we have to come there to even practice, right?
Visit visa, you can come for 3 months.
3 months. Is that enough for like a practicing?
It's not for practicing. This visa they are given to you to come and write this exam. Okay, so they are just giving you this visa to write this exam. Or if you are, if someone can offer you a job, then obviously you can come on work visa.
But like we have to come there for part 2, right, sir? As you said.
Yes.
So like we also need practice before that, and then where do we do that? Like where do we get practice?
No need practice. I mean, this is not compulsory. You need practice, but you need some, the work experience or study yourself in the part 2.
Okay. So like the ma'am said, like we have to pass all the 16 station. Does we really have to pass like a 16 station, or like is there like a 50% pass?
No, this is kind of, honesty. So each station have one lecture, and they will see the, your skills. For example, you give the injectable, as Dr. Sanika mentioned, right? And you have to perform this procedure. So, they will see, they might have their own, assessment for this much marks, and we will give and pass the exam.
So, and also like this ADC license, how many, in which country that is valid for?
Australia.
Only Australia, is it?
Each country, if you are going for a small country, even if you want to practice in Fiji or maybe in your neighbor country, you have to go to same exam in that particular country, right? Are you from which country, Jack?
Sir, Nepal.
If you want to practice in like, Malaysia, even if you want to practice, in India, You might you need to pass the exam. And you will say India is not that, developed country, why I want to write this exam. So you need to write it. In India, a lot of our medical doctors, they are going, study MBBS, Russia, China, even Nepal. And when they come back to India, they need to write exam called FMGE. Okay. And they must pass that exam, then they have to go for 1 year internship. Then they allowed to practice in India itself. And Australia is a high income country. You are trying to come Australia.
Okay, sir. Thank you.
Thank you. Even if anyone want to practice in Nepal, even Nepal also take the exam. Do you know, if anyone completed MBBS from Russia, China, there is a NMC, Nepal Medical Council, they take exam. Yes, any other question? ओके गाइस, आप यहाँ पर 12:45 PM हो चुके हैं ऑस्ट्रेलिया में. So if you don't have question, then we can finish, or you can ask if you have any question and doubt. And please leave your information, phone number, email in the chat box. Our team connect. Yes, sir.
Yes, sir.
So good evening, sir.
Good evening.
I was like curious to know that after spending a lot of money and time and effort, so is it worth it to like come to Australia and practice there?
You are going to earn 10 years in Nepal. You are going to earn 1 year. It's not just the quality of life.
Yes, sir.
So you have to decide, okay, this is worth for you, then you definitely come, how we can say like it's worth or not. So you have to see what you want in your life. In India, Nepal, the salary for dentist might be 20,000, 25,000 rupees. Okay. Now you calculate what is the worth in your dentist in Nepal or in India, and then compare with, the other countries. Because a lot of nowadays the dentistry colleges, especially the private medical colleges, a lot in India and Nepal. So I can say definitely, this much effort and money. Money is nothing basically, you can earn this much money in 1 month. Money is, you are not spending too much. Okay. Yeah, you have to study hard and to pass exam, all those, the process. Definitely worth, I can say. To Australia.
Sir. Hello.
Yes, sir. Yes. Yes, sir. Ask please your question.
Sir, after passing ADC, so what are my chances of getting like job security, sir?
Job security
Job available. Yes, sir. Job availability. Yes, sir.
Yes, Why Australia government give you visa? Australia government saying will give you permanent visa, PR visa, citizenship. Even Nepal, Pakistan, India not given citizenship for any other country people. Right? And Australia is a high income country giving you the citizenship because they need you. You are a dentist. Your occupation in the list, in the shortage occupation list. That's why they are calling you. So I think, Arindam, now we can finish. I think no more questions.
Hello.
Yes, sir.
Yes, sir. Yeah.
Hello.
Yes, sir.
Yes, sir.
Hello.
Yes. Hello.
Yes. Hello.
Hello, sir.
Yes, sir.
Hello.
Yes, sir.
Sir, I need to ask.
Yes, sir. Please ask. Please ask fast. This is 1 PM for 1 AM for me here in Australia. So I'm going to finish. So please ask your question as soon as possible.
So प्राइवेट सेक्टर अप्लाई करना चाहिए वहाँ पर या गवर्नमेंट सेक्टर?
कहीं भी करो, यहाँ सैलरी
कहाँ
और
पर?
होती है. जहाँ जॉब मिल जाए वहाँ जॉब लीजिए. जैसे नॉट इंडिया पाकिस्तान के भाई जॉब का प्रॉब्लम है यहाँ पर. गवर्नमेंट में ज्यादा पैसे मिलेंगे, प्राइवेट में साधन. यहाँ पर बराबर रहते सैलरी, जहाँ भी मिल जाए वहाँ आ जाओ. It doesn't matter.
सर ज्यादा स्कोप कहाँ पर होता है, गवर्नमेंट में या प्राइवेटली अप्लाई करें?
यहाँ गवर्नमेंट सेक्टर में जॉब्स नहीं होती डेंटिस्ट को।
सर वो आप 4 ईयर और 5 ईयर की डिग्री जो आपने की थी वो थोड़ा एक्सप्लेन कर देंगे? वो आप क्या बता रहे थे, मुझे समझ नहीं आया।
नहीं वो बोल रहे 4 ईयर की डिग्री है, वो एलिजिबल है ऑस्ट्रेलिया के लिए। तो जो इंडिया पाकिस्तान की डिग्री है 4 ईयर की से ज्यादा की होती है, 5 ईयर की होती है, तो वो एलिजिबल है ऑस्ट्रेलिया के लिए।
और जो 5 ईयर वाली वो कहाँ पर रिक्वायर होती है?
सऊदी में और यूएस में।
अच्छा ठीक, थैंक यू सर।
Lata, do you have any last question? I'm going to finish.
Sir, one last question, sir. Sir, actually, I passed my postgraduate degree from Lucknow, sir, in OMFS. I'm an oral surgeon. So I was wondering, like, after getting ADC license in Australia, then so OMFS, sir, oral maxillofacial surgery. Hello, Sardar Patel Dental College, sir, RML University, Lucknow.
कितना रुपए देना है
जी सर?
कितना रुपया फी
सर वहाँ पे था 25 लाख।
25 लाख कमाना है, 20 लाख रुपए वहाँ 25 लाख
I had no idea, sir, about that, sir. I was wondering, sir, after coming to Australia, suppose I pass my licensing examination, then what will be the procedure if I want to practice like further, sir? Go one step ahead and apply for oral maxillofacial surgeon in Australia. In US, they are saying that in UK, they want MBBS also, sir, for maxillofacial surgeon. Is it also necessary in Australia also, sir? MBBS degree?
No. You have to go like some specialty after you are registered as a dentist.
Okay, sir.
Okay, guys, then we can finish here. Sanika, you want to say something, or we can finish here?
Sir, yes. Yeah. So for any further questions that you might have had, you can, let us know in the chat box, and we will get back to you with our course fee details and course enclosures of all whatever is included in the course, and also your extra questions.
Okay, guys, thank you so much, and we will see you in our next webinar, maybe after 2 weeks or something.
Thank you so much.
Thank you.
Good day,
Bye.
good day.
Thank you. Okay, Arindam.
Okay, so thank you. Thank you.
Okay, bye.